Good day, everybody. This is an introduction lecture to general medicine for dental students, or the course GMED 411. In this presentation, I'm going to explain why it is essential for dentists to know something about general medicine. Of course, dentists deal only with the oral cavity, and sometimes they just overlook, or let me say forget, that this oral cavity is a part of a human being. Even they sometimes put the rubber dam just to isolate the oral cavity, but at the same time this rubber dam isolates the dentist from the patient. He forgets or doesn't put into consideration that this oral cavity is a part of a human being coming to your care. This patient is coming to your care. He has a trust in you, and he is coming with whatever he might have of general diseases, and he is expecting you to take into consideration his condition, whether it is medical or even if he has done any operation before. So whenever you put a rubber dam, never forget that this oral cavity is a part of a human being. So we have two questions here. Is it necessary for dentists to know something about the rest of the human body? And during their career, are dentists going to encounter problems with any other part of the body? Many general conditions affect the oral tissues, and the oral manifestations of these diseases are normally covered during the dental course in oral pathology. It is important that the dental student hears about and sees something of the other aspects of these diseases. Patients can be systemically ill, having a general disease, and they develop oral symptoms and present to the dental office. Also, the effects of the drugs and medicine that these patients may be taking can require special precautions in the way the patient is treated. Also, another point, patients who have undergone major surgical operations, like for example liver transplantation, should be carefully handled. It would therefore seem indicated that dental students receive a solid medical background. Another point which makes it very clear the necessity to know something about general medicine, that the dental patients over the few decades have changed. This is because the population is aging and the medical services are improving. So patients, or let me say the population, now live longer. An increasing number of patients seeking oral health services are now coming in old age, living with chronic illnesses, taking multiple drugs, medications, and have undergone surgical procedures like cardiac surgery, like organ transplantation, that prolong life. All these have a profound effect on craniofacial health and function, as well as on the dental care. So now on many occasions, a dentist faces a patient, in addition to the dental complaint, has some comorbidities, such as diabetes, or heart failure, or hypertension, that may affect the outcome of the dental procedure. In such circumstance, the dentist must be familiar with at least the basic knowledge about these diseases in order to enable him or her to deal properly with the situation. Recent epidemiologic and experimental animal research provides evidence of possible link or associations between oral infections, particularly periodontal disease and diabetes, cardiovascular disease, and adverse pregnancy outcomes. There's a real need for an aggressive ongoing research studies to better delineate the specific nature of these associations and the underlying mechanisms of action. So, dental surgeons must be able to recognize the patient who is not fit enough for treatment, particularly if this involves minor surgery or general anesthesia. Cardiovascular, respiratory, and hematological disorders are very important in this respect. Many general medical conditions affect the oral tissues, as I have said. So the aim of teaching general medicine for dentistry students is to give them some basic and important knowledge about medicine in order to make them familiar with human diseases in general. And the question is, why? We have 4 aims. In general, dental professionals need to: number 1, identify patients at risk of medical problems; number 2, assess the severity of those risks; number 3, recognize the need for help; and finally, to be able to seek medical advice from a colleague with special competence in the relevant fields. Thank you.